This is the July-August Blue Ridge Healthcare Video President's Report. In order to enhance patient-centered care, it's essential that we first go to the source and learn precisely what patients expect from us. That's the philosophy behind the Patient Family Advisory Council, which held its first meeting earlier this month. The council was created to encourage information sharing with caregivers and to focus on the experiences of both the patients and their families, including their expectations of service quality and safety. The panelists spoke in turn about their hospital experiences. One of them was Robert Boggs, past president of McDowell Technical College.
I think the nursing staff here is the bulwark of this place. When it comes to direct patient care, I believe that.
The patients and their families were very open and honest with us about what worked well when they were patients here, what we could improve on, and other things that we could do that would really set the tone for excellent patient experience.
Senior leadership will study the comments and recommendations that were made during the meeting and will propose patient care adjustments and changes based on those findings. The next meeting of the council is scheduled for October. Demonstrating patient-centered care is often a matter of common courtesy. BRHC's marketing team is creating a series of video lessons that contrast unacceptable behavior toward our customers with the correct way to deliver service. Here is one of those lessons.
Good morning. I'm here to see Dr. Adams. I have an appointment.
Well, it's going to be a while, so you might as well take a seat. Good morning.
Good morning. How are you today?
I'm good. How are you?
Good. I have an appointment with Dr. Adams. I'm Mr. Johnson.
Okay, if you'll just take a seat, we'll be with you in just a little bit.
Thank you.
Johnson.
Good morning. How are you?
I'm good. How are you?
I'm doing very well, thank you. I have an appointment with Dr. Adams today.
Okay. Some of Dr. Adams' patients are requiring a little bit more of his time this morning, but if you'd like to take a seat, I'll keep you up to date on his progress.
Okay.
Can I get you anything?
No, thank you, though. I sure do appreciate you folks.
You're very welcome.
I sure do appreciate you folks.
"50 nurses from across BRHC held a nurse staffing summit on August 15th with guests from the North Carolina Board of Nursing and Carolina's healthcare system. During the half-day session, nursing team leaders, house supervisors, and members of the Shared Governance Council focused on how they could contribute toward the culture of patient-centered care. CFO Robert Fritz spoke on financial challenges as the system comes to grip with more than $6 million in state and federal Medicare and Medicaid cuts over the next 2 years. Community leaders joined representatives from Blue Ridge Healthcare on June 28th for a topping out ceremony at the Marion Medical Plaza construction site. Although the site has received more than 40 inches of rain over the past 3 months, the new facility is still expected to open in early December, only slightly behind schedule. CEO Kathy Bailey extended a welcome to the invited guests, who were also offered tours of the building. Blue Ridge Urgent Care on US 321 has expanded its schedule and is now open 7 days a week. The new, more convenient hours are in response to community requests and was made possible by the addition of an experienced family nurse practitioner to the Urgent Care Center's team. Around 20 volunteers from Blue Ridge Healthcare spent part of a Saturday in August making a real difference for one family. The group worked to prepare a Habitat for Humanity house for its proud new owners by completely painting the interior of the two-bedroom home and landscaping the exterior. 10 students from local high schools attended summer camp of a different sort this year. It's called Camp Med, and its students represent some of the best and brightest from area high schools, and all aspire to a career in health and medicine. Winfield Abee suffered a stroke on June 26th, but 2 months later, thanks in part to Blue Ridge Healthcare's Rehab team, he is back on the job as fire chief for the town of Lovelady. Chief Abee's rehab was the subject of a recent feature story, one that has traveled far and wide. Chief Abee had this to say about his therapist.
My physical therapist is a slave driving up these laws against stuff like that.
On a more serious note, the chief was grateful, and he was resolute.
I'm very fortunate, very thankful, and very blessed that I don't have any paralysis, I don't have anything like that kept me from advancing as far along as I have to be able to do this. When I went to my first rehab at Valdez Hospital, that was where I really learned exactly how far down my body was. I had worked with some other ones, the doctors and the neurosurgeons and things, but when I got into the rehab and they started having me to do the different skills that tested the different bone muscles and things, that's when I learned very quickly exactly what my weaknesses and deficits were. And again, the therapist and the quality of the therapy programs and things. I mean, I was amazed at some of the things in the different ways, the tools that was available and stuff to get me back where I needed to be.
And that's the Video President's Report for July and August 2013. Thanks for watching.